Hello everyone, and welcome to this Ask the Expert webinar on health insurance enrollment and Healthy Start. I'm Megan Hiltner. I'm with the Healthy Start Epic Center. I'll be moderating today's webinar. We have approximately 60 minutes set aside for this activity, and the webinar is being recorded. The recording, along with the transcript and the slides, will be posted to the Epic Center's website following this webinar. Because open enrollment through the health insurance marketplace is fast approaching, we have 12 days left. The purpose of this webinar is really to remind all of the participants here of the value of enrollment for Healthy Start, and to go over ways that local Healthy Start programs can connect with local resources, and provide you with some key messages that you can consider when discussing health insurance. Before I introduce your great speakers for today, I want to give you a couple of housekeeping announcements. We really want your participation, so at any point if you have any questions or comments, you can chat them into the bottom left corner of your screen. We will only be taking questions via the chat box, and we'll be breaking at the end of this webinar to answer them and get to them. If by chance we don't get to all of your questions, we'll include them in a frequently asked questions document that we'll post with the webinar materials on the Epic Center's website. And we also want your feedback for this webinar. So take a moment following the webinar and complete the survey that will pop up on your screen right after the webinar. Let me now briefly introduce your speakers for today. First is Ms. Julianne DeStefano. She's a longstanding Senior Project Officer with the Division of Healthy Start and Perinatal Services, and she's the point person within the division for activities that involve the Affordable Care Act. With us from Enroll America is Mr. Ezra Watland. He's a regional manager with Enroll America, and he's going to be providing the bulk of the presentation today. And we also have, and are so lucky to have with us today, Ms. Andrita Harris. She's a Certified Healthcare Navigator with Reach Up Inc. in Tampa, Florida. So let me now go over today our agenda for the webinar. We're going to first review our objectives. We're going to have some opening remarks from Julianne. Then Ezra is going to go into his presentation on enrollment, and then Andrita is going to share with you an example of what she's doing with regard to enrollment with their Healthy Start organization. And then we'll have some question and answers, and we'll close. The objectives for today's webinar are that we hope that by the end of the webinar you'll be familiar with local resources for enrollment that are available to Healthy Start programs and participants, and we will hear about messages that resonate with participants of Healthy Start programs. Now I'm going to turn it over to Julianne to share some data with you about where Healthy Start grantees are and with regard to health insurance. Julianne?
Hi everybody, this is Julianne. Welcome to the webinar. So glad you all are joining us. I have one quick slide really just before we get into the meat of what our webinar is for. And I just want to talk a little bit about our benchmarks, and one area in our benchmark is improving women's health. And within that we talk about outreach and enrollment and health coverage. And the benchmark I'm going to talk about now is just increasing the proportion of the Healthy Start participants with health insurance to 90%. So that's what we're all looking to do. And currently we have some data that's as of September 2015. It's actually as of August. And it says 15% of the new participants were enrolled in insurance, and it's 9% of the participants were uninsured, which is less than the national average of 11%. I think the message here is that enrolling participants is something that we, as a community-based program, can be very good at doing, and you'll hear more about that. Basically, healthy moms, healthy dads are there to take care of their infants and children and can make healthy families. So with that said, we're going to hear from Ezra Watland of Enroll America, and he's going to talk about the important steps that the local Healthy Start programs can take to help educate families about health insurance and important preventive health services during the open enrollment period, and how he can work with Healthy Start programs nationally. And he's going to give you some resources on that. And with that, Ezra?
Great. Thanks so much, Julianne, and thank you, Megan. And thanks to all of you for the chance to join you on this call. I'm really excited to be here today. In my prior job before I started working with Enroll America, I was with the HHS regional office in Denver, Colorado, the Region 8 office. So got a chance to work with HRSA a decent amount and got to know a little bit about the Healthy Start program. So just really excited for the opportunity to start the process of figuring out some ways that we might be able to collaborate and partner with one another in the future. I'll talk quite a little bit about my organization, and then just sort of about a lot of the work that we're doing to find and work with the remaining uninsured in our country. But I think one of the real continuous through lines that you'll see through all of this is just so much of the work goes into finding the audience that we need to reach. And one of the things that's really exciting about creating new partnerships with organizations such as yours is you're already working with an important population that we're often looking to find. So, just the fact that you're already there on a day-to-day basis and creating these strong relationships, you're already a trusted resource for the women and the families that you work with. It's just a tremendous success that already exists and a huge opportunity for us to figure out some ways to help people moving forward, which is really exciting. So thanks again so much for the chance to be with you and to talk with you today. So before I dive too deeply into the meat of the presentation, let me just take a quick minute to give you a little bit more information about who Enroll America is. We are a national nonprofit organization. We're nonpartisan, nonprofit, and we came into existence in 2011 with one pretty clear goal or mission that we had. We knew that through the passage of the Affordable Care Act, there was going to be this really rare, frankly historic opportunity to work with tens of millions of Americans that would be eligible for coverage options, many of them for the first time, and if not for the first time, then this was a brand new opportunity that many of them were going to be able to benefit forward and potentially find better care as a result. And so a lot of our focus has been that, to do a lot of consumer education and sort of activism to help people feel more confident with the changes that were happening through the Affordable Care Act. And then that really shifted into high gear in late 2013 and from 2014 beyond, once the insurance marketplaces and Medicaid expansion had started so that there were brand new coverage options that folks were able to sign up for. So we knew that this was a tremendous opportunity, but we also knew that this was a conversation that we had to initiate often before people would feel comfortable with taking those first steps into seeking out coverage. So that's been a lot of the work that we've been doing for the past few years. And so I'll just give you a little bit of a sense of some of the ways that we do that. We really have four major components of our organization to reach that ultimate goal. So one, we work with educating and engaging consumers about their coverage options. We focus on improving consumer-facing tools and applications and support infrastructures to help consumers kind of get to the information that they need a little more effectively. A lot of these are digital-facing tools so that people can plug in their specific numbers and personal situations and get a better understanding of what costs they might be looking at in their families. We conduct a lot of research and are constantly looking to develop new cutting-edge resources that can aid enrollment organizations in better approaching their work. And then lastly, we look to partner with organizations as much as possible because, again, this is work that we just can't do on our own. You can see on the right side of this slide that in the past year, going from April 2014 to the end of the last open enrollment period, February 2015, we were able to work with about 6 million consumers in one form or another. A lot of that was through our website or through some of the communication channels that we created, but a huge percentage of that was the result of great community partnerships that we were able to create so that everybody was able to play to their strengths, find audiences that they were already working very effectively with, and then take that enrollment conversation to them. So again, just something that I'm really excited that we can look for new opportunities to partner around with you as well. And let's just take a minute to think through some of the success that we've had as a result of this work to date. So in the past 2 years, through this last open enrollment period, we were able to get about 22 million Americans enrolled into coverage, either through the marketplace or through expanded coverage that was created through Medicaid and through CHIP. Some of these actually were traditional programs that obviously existed before the Affordable Care Act, but just because of the renewed attention and because the conversation was happening nationally at such a high and noticeable rate, we saw a lot of folks even come into what we called kind of the woodwork effect, people that were eligible for coverage options in the past, but just either weren't aware or hadn't taken the opportunity to seek them out and get enrolled into coverage. So a pretty tremendous success, and in many ways something that is pretty historic to see. And for me, at least, I can see this a little bit better illustrated on the next slide, which has a map of the United States and shows what kind of the shift looked like pre the first open enrollment period, so 2013, before these new enhanced coverage options came into gear, and then what coverage uninsured rates looked like in 2014 before this last open enrollment period kicked into gear. So you can see the shift that happened was pretty remarkable. So the darker purple, the color, shows rates that are a little bit higher in the country, and then the lighter kind of beige color is parts of the country that have the lowest uninsured rates. And this is an analysis that we did on a county-by-county basis around the country to better understand what that shift was looking like. And it was just, in many states, the uninsured rate started to melt away, something that we're really excited to see. We're going to release some new numbers, actually, I believe this week, that will show what the impact looked like from the last open enrollment period, so that we have a better understanding as we go into the third open enrollment period. Maybe some parts of our communities that we need to work a little bit harder in, where there might be some parts of the country that haven't seen quite the significant downturn in enrollment, in the uninsured rate as we've seen elsewhere around the country. We actually I got a sneak preview at the new numbers on Friday, and there were a couple of counties that actually had a slight increase in the uninsured rate. So the broad trend that we're seeing is really remarkable and really important, but we do know that in certain areas that have maybe been a little underserved, the work really needs to continue, and there potentially needs to be a stronger push in certain areas. But the broad trend that we're seeing is really exciting and something that I'm just really proud to have been a part of for these last few years. So I'm going to talk a little bit about what the sort of mindset of the remaining uninsured and the newly insured look like at the moment, just so we have a better understanding of some of the needs and motivations that exist to help people get enrolled into coverage, and then what some of the barriers are that could either stop somebody from seeking out coverage to begin with, or could ultimately result in somebody dropping their coverage if we don't address some of their needs. And the main one that is just the major issue or barrier that we've had to work with all along is the issue of affordability. The number one concern that a lot of people have is just that they can't afford insurance. And often this is really much more of a perception than a reality. So there's some great work that we can do around this. For example, the remaining uninsured still do not know about financial assistance that's available. The majority of them don't know, and the majority of people that have enrolled in the coverage are aware of that. So just a little bit of education around financial assistance and affordability can make a huge difference in some of the numbers that you're seeing here, and can address the number one barrier that we're still working around with the remaining uninsured. And I would say, if anything, we've only seen that trend grow in importance. This slide comes from a survey that was conducted right after the first open enrollment period to get a better understanding of what the consumer mindset looked like at that point. So of the remaining uninsured at that point, about 48% of them felt like they couldn't afford insurance, and that number has only grown since then of the remaining uninsured. So if there's anything that we can do to address people's barriers, talking about financial assistance is probably the number one thing that we need to work around. But it's not the only thing. The other major issue that often we're seeing is that people just don't understand this process. They get a little bit confused. They know that it's a cost that they're going to have in their lives now, but they don't often understand some of the benefits that are going to come out of it. And a lot of it is just because the health insurance marketplace and healthcare in general is kind of complicated in this country, and it's something that if you haven't had a lot of experience with, it's nice to have a bit of a guide through the process. Frankly, if you have had a lot of experience with it, often it's really nice to have a guide through as well, just because, again, it can be so confusing at times. And we see that borne out by some numbers that came out of a post-open enrollment survey that was conducted this year. So we know that about half of the remaining uninsured felt pretty unconfident about their ability to make an informed decision in seeking out coverage on the marketplace if they were doing this on their own. About 2/3 of them just wanted more information about what some basic health insurance terms were, so there was a need for some really basic understanding before people were going to feel comfortable about the insurance that they were looking at and potentially signing up for. And this stretches also to folks that are enrolled. This isn't just the uninsured that are in need of more and better information. Of the folks that signed up for marketplace coverage this last time around, about 90% of them said that they would like more information about how to use their coverage effectively. So it's a really important conversation for us to continue beyond people getting enrolled to begin with. And the reason for a lot of this complication is just, borne out by the fact that it's such a complicated system that we have to deal with. We work to get sort of the basic core of what consumers needed to know down to the most basic components possible. And we got them down to six, which is that they need to know why health insurance matters to begin with, when and how they can get coverage, because as we know, it's something that for many people they can only do once per year. They need to know that financial help is available so that coverage is likely going to be low cost or no cost for them. They need to know how to find a plan that meets their budget and their needs. They need to know how to use their health insurance once they have it, and they need to know how to keep their coverage after they sign up for it. So, at its most basic, that's still pretty complicated. I mean, imagine trying to put that on a billboard advertisement or something like that. People would have to, stop in a traffic jam if we were able to get any of the information through it all. So it's really, at its most basic, still far too complicated for a lot of folks that we're looking to engage. So the thing that we ultimately know is that they need to know where to go for help. If there's nothing else that we can do, that's probably the most helpful thing possible, because frankly, not everybody needs to become health insurance experts. This isn't something that a lot of people are going to think about, on a day-to-day basis. It's something that they're going to think about maybe once a year when they're shopping for their coverage, and then maybe a couple of additional times per year depending on what their health circumstances and needs are. So if we can do anything, it's not necessarily to give them all the facts and figures that go into the 6 buckets above. It's just to give them the one thing that they need to know, that they can go to X, Y, or Z location for help when they're confused or have questions in the process. The other thing that we're seeing is a little bit of a splintering in conversations that are happening around gaining marketplace coverage and keeping coverage once people have it. When open enrollment started in 2013, and we were in the first open enrollment period to get people signed up in 2014. In many ways, it was a pretty simple conversation. We were generally targeting and working with the uninsured. And that's still something that was really important last year. It will be important for this open enrollment period as well. But luckily, we are becoming victims of our own success in that the uninsured audience is shrinking in size, and there's a growing need that is being created as well, which is that we have millions and millions of people that are gaining coverage. Many of them, again, have not historically had health insurance coverage in the past, and often are not necessarily experts in this. Again, who in their right mind wants to be experts in health insurance. I love it, but I know that there must be something wrong with me for being this obsessed with it. So, we need to be able to talk to both audiences, and then in between, there's sort of an audience of people that are actively shopping for coverage. All three of these audiences have very specific and different needs, need very specific and different information to be presented to them, so that we're making sure we're addressing, what's most relevant and important to them at any given time. Also, it's important to note that nobody is ever kind of locked into one of these 3 buckets. Often people are moving back and forth on this continuum of coverage. So somebody might be uninsured, and we'll activate them and get them to shop for coverage this open enrollment period. They'll find their plan. If we can do our work really well and help them keep their coverage, hopefully we can keep them in the 3rd category, but often we'll see folks that start out and either get frustrated or get lost through the process, and then they drop off their coverage, and then we kind of need to start back at square one with them. And that's okay. It's just kind of the reality of this work at time. But if we realize where people are in that process, we can have a much more effective conversation with them. And I'll show you a couple of examples of why. So some of the needs that people have if they are still uninsured, it's just to kind of activate that interest and that realization that they can do this, that this is something that's available to them. There is going to be a financial cost available, but it's likely something that they can stretch for and they can prioritize around. So there are a couple of pieces of information that the remaining uninsured need to know. One, they need to know why health insurance matters. Again, often people initially see this as a cost without fully understanding the benefit that they get out of that. So we need to help people understand that there's a real value to having health insurance. Second, they need to know that financial help is available. If any of these folks in the past had tried to shop for coverage, especially before the creation of the health insurance marketplaces, and they weren't able to take into account some of the financial assistance that's available through that, they probably were seeing costs that were significantly higher than what they're able to shop for today. And then the third thing is that they need to know that in-person assistance is available. to help guide them through the process. And the reasons that these pieces are important are, one, we know that the financial help message is something that quickly activates the remaining uninsured to considering options a little more specifically. And it's not just enough to tell them that financial help is available. It's really important to help make that as personal as possible, as quickly as possible. We have a tool on our website that I'll talk about a little bit later toward the end of the presentation called the Get Covered Calculator, which helps people better understand roughly what they might be looking at for a monthly health insurance premium. And during this last open enrollment period, we saw about 25% of people go immediately from our calculator onto their state health insurance marketplace website to start the enrollment process. So just something as simple as a basic tool that will help with the cost and from some real-world perspective for them was enough to motivate a pretty sizable chunk of the population that we were looking to reach out to. And then second, we know that the remaining uninsured has made it absolutely abundantly clear that they want help through the process. We also know that of the folks that get in-person assistance help, they're much more likely to successfully gain coverage versus somebody that goes it alone and tries it on their own. I have a couple of sample messages that were really important motivators for the remaining uninsured during this last open enrollment period. And these are messages that we're pretty confident are going to stay very consistent during this next open enrollment period. So please feel free to use these. The ones that were really important were, again, to mention that free local help was available. This was important because people often don't connect help with enrollment assistance into health insurance with something that's free and has no strings attached to it. So getting that message out there was really important. Also, if it's not an option to use something like a cost estimate calculator, it's really valuable to make this as personal as possible, but often that's just not a conversation that you're able to have. It's good to tie costs back to something that just would make sense in their community. So, make it kind of sound like a neighbor or somebody in similar life circumstances has gained coverage. So a message that just shows that somebody in your local community was able to get coverage for X number of dollars is a really effective way of doing that. And then lastly, mentioning that the deadline is coming up is really important. Again, it's important for people to know that open enrollment has an end date. And then just as important, it was really important this last time around to mention the fine, just so that people were aware of the consequences of not taking action. It's not anything that we felt like we needed to be doom and gloom about. There were a lot of other important motivators that existed, but this was a really important one as well. It's rising in terms of importance, it being a motivator for the remaining uninsured, especially as the fine is increasing in size next year. And we'll talk about that a little bit more in a few slides. So the second category is the group that is actively shopping for insurance. And this is a real mixture. It's folks that might currently be uninsured. It's folks that might have coverage. The thing that they have in common is they're trying to figure out their options. They're trying to understand the vast, complicated array of everything that exists within health insurance. So this is when it's important to have more of a sit-down conversation with an enrollment assister so that people can start to understand what some of these basic terms are: deductibles, co-insurance, networks, co-pays, maximum out-of-pocket expenses. These are all important pieces of making an informed decision to pick the right health insurance plan that's available, and they're often pieces that active shoppers are not fully considering. What we definitely know from consumer research at this point and from understanding the mindset of newly enrolled consumers is that really the first and foremost, they are looking at the premiums, and often they're looking to sign up for the lowest cost premium that's available to them. For many folks, that might be the right plan to select, but especially for individuals that are going to be relatively active users of their health insurance, often those plans that have the lowest premiums have so many more additional costs that go into them that they ultimately result in coverage being more expensive rather than less expensive. If we can help people better understand the entire spectrum of costs that go into health insurance plans, we can help them make a much more informed decision and help them increase their satisfaction with their plan as a result. And then lastly, we have the audience that has gained coverage. So we've done so much hard work to get them to this point. It's really important that we not stop the conversation. just because somebody has gained coverage. Because again, there's so much education and an active conversation that needs to continue so that folks are happy with what they have, they understand the value of what they have, and they're taking full benefit of a lot of those services that are available to them. So especially for somebody that has not had health insurance very recently in the past, there are some pretty basic pieces that are really important to address. Just making sure that they understand how to use their, that they need to pay their monthly premium, how they can use their coverage effectively, and then if there are more complicated circumstances that we need to address, making sure that consumers know how to report changes in their life circumstances, especially around the financial assistance that's available. That's all tied back to household income. So if that income fluctuates in either direction, it's really important to report that so that they can either gain a larger tax subsidy and their costs can go down, or if their income, their household income increases significantly and they don't report it, they will have to pay a certain portion of that back. Basically, at the end of the year, everything is reconciled, everything is evened out through their tax filing. So it's better to report that on the early side and not be surprised with the bill at the end of the year when you're filing your taxes. And then it's also really important to understand the appeals process and that it's really important to renew your coverage every year. The plan that you're in this year might make sense for your specific circumstances now, but these plans change so much, life circumstances change so much, it's vitally important to just take a look at it once a year and make sure that you're still in a plan that makes the most sense for you. And I'll mention really quickly on just some of these basic pieces too about paying your monthly premium. I've seen some survey data that shows that people, the vast majority of consumers understand what a premium is. They understand that it's something that needs to be paid once a month. It's something that honestly to some degree I was starting to take for granted that maybe we had won that and that wasn't a conversation that we needed to have as much anymore. But I've heard some examples very recently in some of the meetings that I've been in with enrollment assisters that just illustrate that that's not the case. For example, I was just in Utah a few weeks ago, and an enrollment assister was telling a story about somebody that they'd worked with that lost their coverage because they had paid their premiums for the first few months, and then they started going to the doctor more regularly, so they were paying their co-pays at the counter, and they thought that covered it, that was paying their health insurance payment for the month, not really understanding the difference between the two. So ultimately, it got them out of compliance with their plan. So even something as basic as that is really, really important for us to address and can be a barrier for people keeping coverage if we don't do that effectively. So that's a little bit of basic understanding of what the consumer mindset looks like at this point. I also want to talk through sort of what we can do to reach out to consumers, the remaining uninsured and the newly insured, to help them understand coverage and make sure that they are getting into a plan that makes the most sense for them so that they can, ultimately have full access to the health care that they deserve to have access to. So first, we know it's really important to engage women. And the reason is because women often are the decision makers around health care for their families. So if we can break in with the wife or the mother of a family, we can reach an entire family and get them enrolled in coverage. And again, I think that there are a number of reasons that this ultimately becomes the case, and I certainly don't want to make it sound like it's a stereotype or anything like that, but it's just something that we know through consumer research is very effective. So I again think that it's a really important example of how Healthy Start can be such an important partner in this work, and how all of your individual programs can be really important partners in your community in helping to get the word out so that we're reaching entire families and getting them enrolled in coverage. And then one of the other major motivators for signing up for coverage is just all of the new opportunities that exist for better access to health care. As many of you probably know, one of the major changes that came through the Affordable Care Act was more enhanced access to free preventive services. And I shouldn't say free because ultimately they do have a cost. Health care coverage is still not free. You are paying a monthly premium, but these are all available at no additional cost. Which is just such a major motivator for a lot of people that often have not had the ability to seek these out in the past. And it's what we know is going to help us get down the road of helping to keep people healthy rather than address healthcare problems once they exist. This is just a really short snapshot of some coverage options that are available on plans for women and families. There's a much more detailed list that's available on healthcare.gov if you're interested in diving a little bit more into detail for preventive services available for adults, for women, for children. All of that is available on their website, and I'm more than happy to help get you linked up with that if that's something you want to explore a little bit more. But absolutely, the benefits that exist within the law and within these new health plans are a major motivator for the uninsured. The other thing is, again, making sure that we equip people with the right tools to make the right decisions as early as possible. I have a couple of our resources that I will make you aware of. And there are others that exist, but we think that these do a really good job of being kind of pro-consumer in the approach that we take, making it as easy as possible for people to use our tools and get the information that they need. The first one that I'm showing is our Get Covered Connector, which is basically a way of finding free local in-person help in your community. People can put in their zip codes, they can do a search right in their area, and they can see all of the federally certified enrollment assisters that are near them. This is completely free for them to use. It would be completely free for any of you to use if you're looking to help people get set up with appointments at facilities that aren't your own. And we ultimately know, again, that people that are able to get in for in-person assistance, they're vastly more likely to successfully complete the enrollment process. So it's one of the most important things that we can do to make getting consumers equipped with in-person assisters. Again, as I mentioned earlier, we know that the fine and the deadline are motivators. They're increasing in their motivation as well for a couple of reasons. The remaining uninsured are a little more budget-driven in the decisions that they're making. And at the same time, the fine is growing. During the first open enrollment period, the minimum fine was about $95. It actually was tied to income, so it was $95 or 1% of your income. So it was actually substantially more than $95 for most people. But that was kind of the message that was out there. If I don't get health insurance, it's not a big deal. It's $95. I'll just pay the fine. Well, it's absolutely growing in size and therefore importance in the number of people that are going to make a decision on the other side. Now the fine is $695 or 2.5% of your income, whichever is higher. It's getting to the point where there's very likely to be health insurance coverage options that are cheaper than taking the fine for a lot of people. And it's much more of the case that people kind of don't want to get nothing for what they're paying. They can get good coverage, or they can pay the fine for roughly the same amount of money. So at this point, they might as well seek out coverage. I think that's kind of the decision that a lot of people are making. So it's obviously not enough to just say that the fine is out there. It's also really important to follow that up with helping people understand that they can afford this. Again, as I mentioned earlier, it's not enough to just say that financial help is available and make that some really broad declaration. It's really important as much as possible to tie those costs back to individual consumers' circumstances. They need to know how much it's going to cost and what it's going to cover for them. So the tool that we created to help make that decision is called the Get Covered Calculator. It's a really simple, basic tool to use that's only reliant on your zip code, your household income, and the number of people that are going to gain coverage in your household. And basically, all it's trying to do is give people a ballpark estimate of what they can expect to pay in their health insurance premium. To give you a little bit of background, the spectrum that we provide goes from the lowest cost bronze plan to the second lowest cost silver plan. That's generally the range of plans that the vast majority of people end up selecting anyways. It doesn't give people the entire spectrum if they're looking at potentially gold or platinum plans or getting a little more complicated in what they're searching for. And that's really by design. We didn't want to make this overly complicated. We wanted to make it as clear and simple as possible for people to make this initial decision that this is probably something that they can afford. So again, this is a completely free tool to use either for consumers or for any of you that would be interested in building it into your work. And then, this really isn't about a tool that we have. It's just about a really important practice that we've developed coming out of this last open enrollment period. What we saw coming out of the first open enrollment period was that if we were able to have consistent follow-up with consumers, we were able to really significantly increase the likelihood that they would successfully enroll in coverage. And the sweet spot seems to be about 3 to 4 good conversations that we were able to have with folks. If we were able to have one conversation there was still a pretty significant bump above the baseline of somebody that just goes it alone to get their own coverage. But if we were able to follow that up with a third or fourth conversation, we were able to, in many cases, double or triple the likelihood that somebody was going to enroll. And you can see on this slide some specific populations that we're working with a little more directly, and that's largely because they were uninsured at higher rates than the national average. So young adults, African Americans, and Latinos are populations that we work really closely with. And for young adults, for example, again, there's about a three times higher likelihood that somebody is going to successfully enroll if we've had 4 active conversations with them about the enrollment process versus just having 1 conversation with them. So if I can equip you with anything from this webinar, I would say don't feel like 1 conversation is enough. And if you're not hearing anything back, if you're not getting questions or requests for follow-up, it's often on us to start that conversation again. Another tool that I would like to let you all know about, it's a brand new one that we're going to use for this next open enrollment period, is the Get Covered Plan Explorer. Again, a lot of our goal as an organization is to make it as easy as possible for consumers to make educated decisions, and often that's really hard around health insurance because it's so complicated. There's so many variables that you have to try to keep an eye on, and within all of those variables, every single plan can be so different. So we developed the Get Covered Plan Explorer to help streamline that process as much as possible. It'll allow people to put in some basic information, again, about their household circumstances, about any health conditions that they have, and out of that we can generate a shorter list of plans that they might want to consider. A couple of things I'll mention about it. It is something that's completely objective. We're not pushing people to one plan or another. We're simply letting them use the information that they know they need to keep an eye out on to make sure that they're getting into plans that best look out for those. So if they have a specific doctor, if they have a specific prescription that they want to make sure is covered, we can help them find the plans that make the most sense given those circumstances. I'll also mention this is a tool that currently is only available in federally facilitated marketplace states, so states that use healthcare.gov as opposed to a state-based marketplace website. And that's just because of the data set that we needed to create this. It's consistent and available in marketplace in healthcare.gov states in a way that isn't quite the same in SDM states. So just wanted to make people aware of that. But it's something that, again, is going to be absolutely free to use. It's going to make the browsing process a little bit easier. It's something that we really encourage some follow-up and further conversation around. I would say that just because a plan pops up on our tool based on the input data that we received, that isn't necessarily enough on its own to say that's absolutely the plan that somebody should select. Just because, again, networks can change. Data that's going in might be slightly wrong. So it's good to just follow up and maybe have a phone call with the insurance plan or your healthcare provider to make sure that they're accurately included in the tool. So just to mention a few things that this tool does not do, we don't rank plans or favor one plan over another. Again, we keep it as objective as possible. And then we also don't currently use quality ratings. And just so people are aware, if this is somewhat of a new term, HHS is now providing some quality ratings around the plans that are available through healthcare.gov to help drive traffic a little bit more to plans that have been kind of the most positively reviewed and most positively used and seem to provide the most value. That's not something that at this point in time we felt we had enough information to incorporate into the tool, and that could be something that we provide in the future. But we just wanted to take that variable out to keep this as simple as possible. So again, the Plan Explorer tool is a free tool that can help streamline that process of considering plans. So before we transition out of this presentation, I wanted to provide you with just a couple of key takeaways that go into the work of finding the uninsured populations that we're looking to reach out to, making sure that we're engaging them effectively, and making sure that we're ultimately helping them succeed in the process of gaining coverage. So one, it's just so important to know the population that you serve. A lot of what I've talked about is are some national trends that are broadly really applicable in just about every community, but there are going to be complete differences that exist. So it's really important to be able to acknowledge those and speak the language of the community that you serve as much as possible. Also, it's very important to learn what new enrollees value so that we can drive that conversation in a way that's effective in reaching the populations that we're looking to serve. We need to meet consumers where they are in the process. Just because we have sort of a set understanding of what we think consumers should be considering. Doesn't mean that that's where everybody is. So it's really important to address the specific motivators and barriers that exist in somebody's personal circumstances. It's also not enough to just share information. Just because we're passing along information about any of the tools that I've mentioned or the marketplace website, all of that's helpful, but consistent follow-up needs to back that up as well, so that we're making sure that the conversation continues. And then again, developing partnerships is such an important way to do this. Again, part of the huge reason that I'm excited to talk with you all today is because as much as we can create those professional relationships and professional referral networks, we can find the populations that we're looking to serve because many of us are already working with them in our day-to-day work in a different capacity. So often it's the exact same population that we're looking to have a different conversation with. So where can we find those points of contact that already exist and just add this conversation into the mix? I have a couple of resources that are available. I would encourage you to check out both of our websites, enrollamerica.org and getcoveredamerica.org. So Enroll America is our organizational website where we have more information that's available that's maybe a little more policy heavy. Get Covered America is our national campaign that exists around the country to get information in the hands of consumers. So it's a little more consumer facing. You might be able to find good printouts or things to share there. I threw some links that I thought might be interesting to you, but I would encourage you to just kind of explore our websites because we have a wealth of information that we've developed over the past few years, much of which is absolutely still completely relevant to this day. And as I mentioned earlier, I am a regional manager for Enroll America. I cover sort of the Northwest and the Mountain West of the United States. So I don't cover the entire country. We have people kind of all around the country that are available to you. But one person that I wanted to make sure that I equip you with is Ebony Rice, who is our National Young American and Women's Engagement Director. So she is working on a national level to create these partnerships and these enrollment and outreach best practices in several organizations, and would be a great point of contact for any of you. I'm more than happy to stay in touch with all of you as well. But she's the person that's going to be kind of the driving force in a lot of the women and young family-related work that we'll be doing moving forward. So that's all I have for my presentation today. Again, my hope was to just give you a little bit of a primer on some of the basic trends that we're seeing as we enter this next open enrollment period, and then begin to explore how we can partner together moving forward. So I'm really excited to keep the conversation going forward. I see this as just the beginning, not the end of some of these really important dialogues that we'll have to have moving forward. So thank you so much for the chance to be with you here today. I'll hang out for the rest of the webinar, and I'm going to be happy to answer questions at the end if anybody has them. And for now, I'll turn it back over to you, Megan.
Thank you so much, Ezra. What great information that you have there. Thanks so much. Before we open it up for questions, everyone, we're going to now hear from Ms. Ardrita Harris. She's with Reach Up Incorporated in Tampa, and she's going to share a specific Healthy Start grantee example of what they're doing with regard to enrollment at in their program. So Ardrita, I'll turn it over to you.
Thank you very much, everyone, and thank you so much for allowing me this opportunity to share with you some tidbits of information in my role as a certified navigator, and I'm assigned with the nonprofit organization Reach Up Incorporated, who are wonderful. Let me share with you a story first to kind of set the pace and the stage for this. Excuse me. During Minority Mental Health Month, which was back in July, I had distributed some flyers, as I normally do, to the locations that I will go with during an event or to speak with a client. And during that time, that one of those flyers was picked up by a consumer who reached out for help as a result. Although the consumer has insurance, she had a recent diagnosis of mental illness issues and had been prescribed several medications. So now the consumer needed a program of support. Well, clearly, in my scope of responsibilities and also in my background, it's not mental health. So I thought that the Community Resource Center would be the perfect place to reach out and ask, well, what do you know, or who do you know that I could have a dialogue with? Fortunately, the Community Resource Center happened to be the right place at the right time. There was just hired a licensed clinical professional who could provide the program support of what that consumer needed and was requesting. So I obtained a verbal consent from that consumer, which we're allowed to do that, to ask her if I could share just her name and phone number to get her that assistance she needs. I connected with the resource center, and the transfer was made of the consumer to the mental health professional who took it and ran with it to get that consumer exactly what they needed. I was so elated and thankful, and in fact the consumer called back to say that she was very helpful and very impressed with our organization in providing her help so soon. So going the extra mile might mean handing out a flyer, having someone responding to it, and at the same time turning that around into a helpful situation that was positive for that consumer. One of the things I wanted to, in my brief moment here, is to share with you some information. As persons in the field, you don't need to know all the information about the Affordable Care Act and down to the minutes and the data, the statistics, and how it all works. It's helpful to know key things that Ezra just shared and key things that I'm going to share with you now. There is a process, as Ezra highlighted in several of his slides. There's a process in place for persons who do not have insurance coverage or uninsured or underinsured. And the marketplace is a location for them to come to check to see if they really qualify. And when I say that, I mean, do they qualify on a specific level of insurance coverage, or do they qualify based on the number of persons in their family? Because that's how you really get to the meat of what's qualifiable. If you have a family of two persons, husband and wife, well, they're likely to get as tax credit or assistance as would a family after adding 3 children or 4 children. Those children may range in age from 2 years old to 15 years old. And they would need different kinds or different types of insurance coverage based on generally what are the medical needs of children in that age range. But also the additional is that assistance can be provided through tax credits and also assistance with paying the premiums. But we won't know that, and neither will the client until they complete that application. What we've done this year to help with that process in those scenarios and others is a marketplace application checklist. It's provided to the consumer. They can log on to healthcare.gov, but there are several documents that they will need prior to filling out that application. And we provide those checklist items for them so that when they're sitting down talking with a navigator such as myself, or they go online to get the start of filling out the application online, they will have everything that they need. Another thing we instruct them to do to make sure that every person in the household who is applying for insurance has all of their correct credentials. And those credentials could mean a Social Security number, or they have an immigration code number. Whatever it might be, they must have that prior to sitting down to fill out the application, because those questions will be asked at that time. At the end, I'll give you those 5 tips about the insurance marketplace. Another thing that I've done to assist those persons in the field is to provide something I started just as a fill-in and has turned into something that's pretty successful, and that is NAV News, NAV, short for Navigator News. It started that back in March, and it caught on because the clinicians and the persons in the field said, hey, I didn't know that, and they were taking notes, and after our staff meetings they were asking questions, good inquisitive questions. And I thought, now maybe this might be something I should continue, and I have continued it since that time. And the number of referrals that the clinicians come into contact with are the ones who we really need to get to reach out to. So it's working out on a one-on-one basis for the clinicians and myself, but more importantly, we are aiding the consumers in our population areas that we service. The other thing I'd like to share with you is a point that I think I saw on Ezra's slide, but how to get covered and the new Plan Explorer. one of the other things that we do as navigators is to make sure that all of the information that is provided by the consumer is accurate. If there's any inaccuracy and they get the application returned to them to get the information, it's really going to take a long time. So what we've done now is, or I as a navigator, as well as my colleagues, because I'm not alone in this, by the way. There are quite a few of us in the consortium. But one of the things we make sure we try to get information out to a larger population. One-on-one is going to be surely our market of what we're calling for to make sure we have hands-on to guide them through, but we will also sponsor and provide events. And that's where Enroll America comes in, because they align with that process for us, and they are able to get that population that we're trying to service for those events there and ready to go on with the process of filling out an application. In last year's enrollment, I can't tell you how valuable that resource was. We decided to target a population, as you may have seen on the slides, of African Americans in certain zip code areas. Well, we didn't really know how quite to go about it, but Enroll America says, well, we've been working with churches. And that's how that alignment came through, that we were able to do more churches as we expanded our growth throughout the zip codes. And they were the most successful they have ever had as far as in the state of Florida. So working hand in hand, joining up, and also aligning with others in this organization or in this process is very helpful, and it also aids and benefits our consumers. So as I said, the final thing I wanted to give you were some tips. And if you need to look at the detail of them, send me an email or send it through your organization. I'd be more than happy to share. But number one, the health insurance marketplace is for people who don't have health coverage. Number two, what you pay for insurance depends on your income. And that's one that's always a sticky wicket, and we try to make sure we're explaining everyone. It depends on your income. That means household income. The third one is you can apply for coverage 4 ways, and that is still true. Online, by phone, with in-person help, and with a paper application, although the latter is going to the wayside because it's much more efficient online or with a navigator. And the last one, number 5, get ready. Starting November 1st, that's when the new process for starting the marketplace, I shouldn't say the marketplace, you're applying for your coverage to start in January 2016, then you'll be filling out an application, or the consumers will, starting November 1st, 2015. The effective coverage date is January 1st, 2016. Let me pause now and ask what questions might you have. I hope I didn't go too fast with that.
Actually, Ardrita, there is a question that did just come in, and I think you're the best person to answer it. It is, how long does the process generally take for a participant to be considered insured?
We're considered insured once you pay your premium and you're sent notification from that insurance company. Is that what her question really is?
I think maybe the question is also around from the point of the application process to the point when they have been approved. How long does that take?
No problem. The quickest way is when we do online. It could be either one-on-one or even at one of our events. And the online, you would instantly get a reply back from the health marketplace which says, congratulations, you are covered, and they provide you with an application ID. Now that ID is important because if you don't complete your application in one sitting, when you're online of course, then you can always log back in, but you must have that application ID. So say for example someone comes to one of our events, or I'm one-on-one with that client. If they have everything according to the checklist, and that's where the key is about that checklist, then we can usually go through it in an hour because they will have all that information. And the shortest amount would be persons who are applying for 1 or 2 people in a household. When you have others in the household who will require that, you'll need to have all of their information as well, so it may take a little longer. Online is the best way to do it. It's faster, it's easier. we have very few people who will ask for a paper application, but an hour, no more than an hour and a half if you're prepared. Does that answer your question?
I think that did sound like it did, and I did find the link to the checklist you've been referring to, and so I'm going to post it to all in the chat box.
I was trying to find, where's my link? One other thing, maybe it would also be worth to point out for the person who just asked that question, is about documentation for legal immigrants. And that's what the profile I was interjecting as far as how long does it take and who's applying. So if you have that information for legal immigrants, then that documentation information is vital, because the marketplace system automatically goes out and validates against two databases, Social Security and the IRS. So they can grab and match and validate information online. That's why I stated online is a quicker way to do it, because you're actually inside and are able to then have your information reached out and piloted to IRS and Social Security and immigration.
Thank you. So another question came in, and Ezra, this one is for you. It's two parts. How do folks find out who to contact with through Enroll America to begin to get resources and learn more about what you all do and provide? And then the second part is, how much does the support and working with Enroll America cost?
Okay, great question. Well, I'll take them out of order. So basically, we are a free service. We're as free as is humanly possible. Our goal as an organization is to help get people enrolled in coverage, and we see any enrollment as a success. So we absolutely want to just be as available as possible for you all. There are some slight exceptions to that, but usually they're based on really intensive programs and more just to try to figure out travel costs or something like that. So in general, please feel free to reach out to us, because we are probably more than interested in trying to figure out how we can work together and how we can get the right resources into your hands. And then how to get in touch with us, there's a couple of things to let you all know. So we are an organization that works in all 50 states around the country. We do that in two different ways, though. We have about 10 states in the country where we have a team in place on the ground that's focused solely on that state, and their goals are twofold. One, to work with consumers directly, and then the second one is to partner with organizations. And then outside of those 10 states and the other 40 states, we work on a regional basis, and that's the side of the organization that I'm on. So I don't do as much of the direct consumer work. I do much more of the partner work, so that we can help develop programs and help enhance your efforts as much as possible. I would say that the easiest way to do that, I'm going to just skip back really quickly a couple of slides and just show you on the resources page that I provided. At the top, I have Enroll America's state and regional leadership, and that will give you the name of the person that covers your state. The contact information, I realize, isn't directly on that. So I would say once you have that person's name in place, you can either reach out to me. My contact is information is at the end of my presentation, or you can reach out to Ebony, who's our national lead, and will be a great point of contact for any of you at any time.
Thank you so much, Ezra. So folks, we're almost at time. I'm not going to go through all of these other enrollment resources, but there are a series of enrollment resources here on the slides. Those slides were sent to you with your registration, but check them out. They could be of real benefit to you in your work. And then I just wanted to wrap up with a couple of upcoming events. On October 29th, there's a webinar on an overview of the Continuum of Care program, which is through HUD, that will be shared for Healthy Start programs as well as McBee programs. Then just want to also remind everybody about the Healthy Start Convention. That's November 16th and 17th in Washington, D.C., and registration is open now. All of the webinar materials, recorded webinars, transcripts are included on the Healthy Start Epic Center website, so check that out. I want to give a huge thank you, sincere thank you to the 3 presenters today, to Julianne, to Ezra, and Andrita. Thank you so much for sharing all the great tips that you've shared today and the resources. You all provide such great insights and support to grantees in this effort and other folks in their enrollment efforts. So thank you so much. And thank you all. Oh, go ahead, Ezra. Any final comments? Any final comments?
I just wanted to say thanks to you, Megan, for inviting me, and thanks to everyone for having me join you. And best of luck as you move into this work. It's really exciting and rewarding work.
Yeah. Thank you so very much as well. I do appreciate it. Your organization is outstanding.
Wonderful. Well, thanks so much, everyone. This will conclude our webinar for today. Thanks so much for your participation.